Everyone has heard of pneumonia. In fact, it's a huge complication that leads to death. In my presentation, I'm gonna discuss aspiration pneumonia. Aspiration is a lot like choking. It's when food or stomach acid enters the lungs. Aspiration pneumonia is when pneumonia, which is a lung infection, develops as a result of aspirating. When food or stomach acid enters the lungs, the particles remain there, and this allows bacteria growth and cause an infection. Before talking about the problem in details, let's talk about the normal mechanism. So, how your horse's respiratory system works. The horses only breathe through their nose, so the nostrils are the main entrance and exit for the respiratory airways. The primary function of the respiratory system is to transfer oxygen from the air that the horse breathes to the red blood cells. It will then be transported throughout the horse's body. In addition, the carbon dioxide is eliminated from the body via the lungs. If this system is compromised in any way, it will severely affect the athletic ability of a horse, and may even be life-threatening. Now let me demonstrate the causes. What causes the aspiration pneumonia? In fact, there is a lot of reasons, such as inhalation of foreign materials, like a dust or food, congenital problems, like a cleft palate, illness that causes swallowing difficulties, maybe neurological conditions, such as stroke or traumatic head injury, or eating too quickly. All of these factors may help in the aspiration pneumonia. Now let's consider the pathophysiology. In normal healthy horses, the mucociliary mechanism and alveolar macrophages act as defenses in clearing microaspirations from the oropharyngeal secretions. The pathological process of aspiration pneumonia occurs when the normal defense mechanisms fail in a predisposed individual. The entry of fluid into the bronchi and alveolar space triggers an anti-inflammatory reaction, with the release of pro-inflammatory cytokinase, tumor necrosis factor alpha, and interleukins. Inoculation of organisms of common flora from the oropharynx and esophagus results in the infectious process. So, the severity of the injury to the pulmonary tissue following aspiration depends on the amount and composition of the aspirated material. If large quantities of fluids are aspirated, the animal may die acutely. If gastric contents are aspirated, then the damage is severe with pulmonary edema and hemorrhagic pneumonia. Aspiration of mineral oil leads to chronic and progressive granulomatous pneumonia, which is difficult to treat. In general, aspiration of material into the lungs leads to bacterial contamination of the lower respiratory tract, which overwhelms the normal respiratory defense mechanisms, resulting in pulmonary infection, lung consolidation, and in some cases pleural pneumonia. This picture demonstrates a specimen with the typical features of the disease, which is taken from a horse's lung. Now let us imagine how does our diseased horse look like. The signs that your horse may have aspiration pneumonia is usually obvious because of the nature of the condition, but it can easily be missed in the early stages. So, since the damage to the cilia causes coughing, choking, breathing difficulties, and high fever, it is easy to tell that the lungs are compromised. The most commonly reported side effects include weakness, lethargy, depression, fever, increase of the heart rate with or without coughing, appetite loss, watery eyes, nasal discharge may be green, red, or brown. Now, which group is most affected? Horses are very tolerant of the entry of foreign material into their trachea without the induction of a severe coughing response, compared with other species. Foals up to 8 months of age, pneumonia is particular emergency, because it is often fatal if not diagnosed and treated hard and fast. Furthermore, diagnosis is based on clinical history and signs, auscultation of the respiratory tract, endoscopy of the respiratory tract with the collection of tracheobronchial samples, thoracic radiography, blood samples for hematology and biochemistry, and ultrasonography of the chest. Now, last thing to mention in my discussion is its prognosis, which is guarded to poor, very variable depending on the severity of the pneumonia, the inciting cause, the ability to resolve the original inciting cause of aspiration, the volume and nature of aspirated material, the type of bacteria introduced, and the rapidity of treatment. All have an influence on the final outcome. I have now come the end of my presentation, hoping you like it.